Welcome to the deep dive. Have you been hearing about India's rise as, well, a major player in global healthcare?
It's definitely a big story.
Yeah, it's huge, and it seems to be happening really fast. So today we're diving into what's actually driving this incredible growth and medical tourism there.
That was good.
Our source material for this deep dive is a transcript from a webinar that really peeled back the curtain on the very first World Medical Tourism Congress held in India. Think of this as your direct line, into understanding the key forces, the opportunities, and the whole changing landscape of this market. It's all straight from folks who are right there at the center of it.
Right.
Our mission, to pull out the absolute most important insights from this material and give you that essential shortcut.
Okay, let's unpack this then. It might seem complex, lots of moving parts, but this webinar transcript, it really does provide some clear points we can connect. Makes it easier to see the whole picture.
Right. So jumping right into what the webinar participants were discussing, the basic question, why India? And why is its medical tourism scene just, well, exploding now?
Well, India isn't exactly new to the game. They've actually been active regionally for years,
Okay.
attracting patients with what the source described as world-class healthcare systems, top hospitals, and crucially, highly skilled physicians.
Uh-huh.
And many of these doctors, we heard, actually trained overseas, UK, US, places like that.
Right, so the quality foundation was there.
Exactly. And for a long time, this was mostly driven by the private sector.
That makes sense. Build quality, people nearby will come. But the webinar highlighted something changing more recently, didn't it? A shift.
Absolutely. That seems to be the big catalyst. There's been a significant increase in government support. Under Prime Minister Modi and various ministries getting involved. They specifically pointed to things like the formation of the Medical Tourism and Wellness Travel Council.
Okay, so more structure.
Yeah, and active support from organizations like NABH, that's the National Accreditation Board for Hospitals and Healthcare Providers.
Right.
What this signals, really, is a much more consolidated strategic effort. Not just maintaining standards, but actively promoting India on the world stage.
And when you pair that kind of focused government push with just the sheer scale of India itself,
Right.
what is it, over 1.25 billion people,
Yeah.
an economy ranked 9th globally back then, GDP over $2 trillion, you start to see the potential, the groundswell.
Exactly. And the numbers they talked about really bear that out.
Mm.
The webinar mentioned, back in the context year of their discussion, the Indian medical tourism industry was expected to hit something like $6 billion by 2018.
6 billion.
And get this,
Yeah.
patient numbers were projected to literally double over just 4 years from that point.
Double, wow.
Yeah.
Yeah.
And India was already ranking number 5 on the MPA's 2016 Medical Tourism Index. That's the Medical Tourism Association. That level of growth is just, it's phenomenal.
Doubling patient numbers in 4 years, that is serious momentum. So what's the core hook then? What's drawing these international patients, according to the webinar? What's the irresistible appeal?
It really seems to boil down to a powerful combination. High quality and incredibly low cost. This was a central theme they kept coming back to.
Low cost is always a big driver, of course. But how low are we talking here?
The figures they quoted were pretty striking. Medical treatment costs in India are, on average, maybe 18th to 15th of those in the West.
1/8.
Often, yeah, anywhere from 70% to even 90% less.
Wow, 70 to 90% less. That's an astonishing figure. And the key point, according to the webinar, is that this low cost doesn't mean you're cutting corners on quality.
Precisely. They were really adamant about that. They kept citing those world-class hospitals and the highly skilled professionals as the reason quality stays high, even with that huge price difference.
Another factor they mentioned, seems simple, but it's actually huge for international travel, is language.
Right, no language barrier for English speakers. That immediately just simplifies everything immensely for a huge chunk of potential international patients.
Makes sense. And they also touched on treatments beyond just, conventional Western medicine, didn't they?
Yes, and that's a really fascinating layer here. The webinar highlighted the draw of holistic treatments, things like Ayurveda, yoga, homeopathy.
The traditional side.
Exactly. Especially appealing, it seems, to travelers from places like Europe and the Middle East. It positions India not just as a medical hub, but as a kind of traditional crossroads, benefiting from offering this really wide spectrum of wellness options. It's more than just getting surgery. It's framed as a whole healing experience.
So it's broader than just complex procedures, it's health and wellness. Okay, let's talk money then. What's the sheer economic scale? The opportunity presented by this boom?
They gave some pretty big numbers. The overall Indian healthcare market was valued around $100 billion at the time of that webinar,
Okay.
with projections to grow massively up to $280 billion by 2020.
That huge growth, though, it isn't solely from medical tourism, is it? What's driving it internally within India itself?
Exactly. Good point. They broke down those internal drivers, too. A rapidly growing middle class, with more disposable income.
Right.
A rise in lifestyle diseases, heart conditions, diabetes needing more ongoing care, an aging population, obviously requiring more healthcare services overall, and just simply greater accessibility to higher quality healthcare across the country than maybe there was before.
And what about enabling the international side of the business? They mentioned some factors there, too.
Yeah, things like, easier travel generally, the power of the internet for finding information, comparing options.
Sure.
And also technological leaps like telehealth and M-Health, making consultations and follow-ups easier.
Right.
And crucially, the webinar emphasized that the opportunities aren't just limited to the hospitals and clinics doing the procedures.
Oh, what else?
They saw significant potential in what they called ancillary services. So technology providers, advisory services, consulting.
The supporting industries.
Exactly. And this is all fueled by those favorable government policies we talked about and that broader growth in the health and wellness sectors. It's really a whole ecosystem opportunity, not just one thing.
That's interesting, the ecosystem angle. The webinar also talked about how the global medical tourism industry itself isn't static, it's evolving. How is India influencing that bigger picture?
Well, traditionally, it was mostly about patient movement, right?
Yeah.
Patients flowing from one place to another, driven by providers, maybe insurance companies, governments facilitating outbound care, and facilitators.
Right, people needing care going somewhere else to get it. Pretty straightforward.
Right. But the key evolution, according to the webinar, is that developing markets like India are now actively seeking outside expertise.
Oh, okay. So not just providing care, but looking for help.
Exactly. It's no longer just a one-way street of patients flowing to centers of excellence. These countries, like India, are looking for help with things like capacity building, developing specialized clinical programs, training their own physicians and nurses, getting consulting services, technology solutions, software, telemedicine platforms, and also help with accreditation to meet those international standards.
So the new buyer profile they mentioned isn't just patients anymore, it's broader.
Precisely. It now includes investors looking at the Indian market, major healthcare systems from the U.S., Europe, or the Middle East looking for affiliations or training collaborations, maybe physician exchanges.
Interesting.
And it even includes other newer destinations that are just starting their own medical tourism initiatives and are looking for blueprints for expertise from places like India that are further along.
So what's fascinating here, it seems, is that players traditionally seen just as providers in these developing markets are increasingly becoming investors and buyers within the global industry.
Exactly.
That really fundamentally changes the dynamics, doesn't it? They're not just receiving patients, they're actively shaping the field.
Exactly. They're moving up the value chain, so to speak. It's a two-way street now.
Let's use the event itself then, that first World Medical Tourism Congress in India, as a kind of tangible example. How did that event show these new connections and dynamics playing out? What made it significant, according to the source?
They highlighted three main things that made it stand out. Its specific agenda and the educational platform they offered.
Okay.
Its dedicated buyer program, which sounded quite intense. And just the overall quality and profile of the attendees they managed to attract.
So let's break that down. The networking.
Yeah, the networking was designed to be really comprehensive, bringing together leaders from, all the key areas. Insurance, industry players, TPAs, the third-party administrators,
Right.
providers, obviously, wellness companies, employers, big multinational corporations, tech companies, government officials, and the facilitators who connect patients to providers.
A broad mix.
Very broad. And they even offer practical things like tours of major hospitals as part of the package for international guests.
And that VIP buyer program, that sounds like a serious effort to curate the audience. They were expecting up to 100 hosted VIPs.
That's right, hosted, plus many other buyers attending normally, but all of them carefully vetted.
Vetted how? What was the criteria?
They had to demonstrate sending volume patients, not just, one or two here and there, but significant numbers.
Okay.
And interestingly, both outbound and inbound patients from multiple destinations. It was really about connecting with the organizations that truly drive large-scale patient flow.
Did the webinar give any concrete examples just to get a sense of the scale?
He did, yeah. And they really bring it to life. Like a GCC insurance company sending 20 patients a month overseas. An African facilitator sending 4,000 patients just to India annually.
4,000? Wow.
Or an Iraqi facilitator sending 8,000 patients overseas per year total. They also mentioned a Dubai insurance company covering over 500,000 lives.
Huge reach.
And another facilitator in Dubai sending over 200 patients monthly overseas. They even listed specific examples of attendees, naming names and organizations from places like Afghanistan, Oman, Mongolia, the UAE. It really showed the global reach they were achieving.
That paints a really clear picture of the kind of business connections potentially being made there. And for the Indian healthcare providers attending, it was like a direct line, right?
Absolutely. A prime opportunity to showcase their programs, their services, maybe present specific case studies directly on the agenda to these verified international buyers. And they didn't forget the sort of softer side either. They mentioned unique social events planned, like a tour to the Taj Mahal, a visit to the Formula One circuit, adding that extra dimension beyond just meetings.
Right, building relationships too. It sounds like a packed agenda, really focused on making real connections happen. Now, beyond the big organizational level, the webinar also touched on how individuals could benefit professionally from all this market growth.
Yes, a key thing they emphasized was this certification program, the Certified Medical Tourism Professional, or CMTP, workshop. They held it right there at the event.
Okay. CMTP.
And they framed it as pretty essential for anyone really involved in the industry, whether you're working at a hospital or you're a facilitator, maybe an insurance, or even a consultant. Basically, anyone looking to gain a competitive edge and, advance their career in this space.
What are the specific benefits they outlined? Why get certified?
They listed several compelling points. It helps you offer a higher service level to international patients, which is crucial. It teaches best practices in actually managing those specific, often complex patient flows. It can help you add a niche business model focusing specifically on medical or dental or wellness travel. And fundamentally, it just helps you set yourself apart from competitors in the field. It's positioned as a way to enhance your career, build your personal brand, maybe open up new job opportunities. And they really highlighted the value proposition too, mentioning a significant price difference for event attendees. Something like $400 compared to the normal $1,500 cost.
Big difference.
And that included a 3-year membership to the Medical Tourism Association and access to online resources. So a tangible incentive.
And for organizations, not just individuals, they also detailed ways to boost their visibility, right? Sponsorships and partnerships.
Right. The standard ways, options ranging from sponsoring the big galas or the tours we mentioned to putting your name on panels, registration areas, networking lounges, ways to increase brand awareness.
Sure, typical event sponsorships.
But they also mentioned something maybe a bit more targeted, hosted private event option.
Oh, how did that work?
It sounded like a way for an organization to target a very specific group of buyers, maybe from a certain region or certain types of companies, for exclusive access. Really putting that organization in the spotlight, as they put it.
More focused networking.
Exactly. They noted it was limited availability, but listed the kinds of organizations that could really benefit hospitals, obviously. But also airlines, facilitators, government promotion bodies, tech providers, anyone looking for that kind of highly targeted exposure.
Okay, so pulling it all together, the webinar transcript really paints this powerful picture, doesn't it? Immense potential, tangible opportunities right there in the Indian medical tourism market.
It absolutely does. And the Q&A section they included further highlighted how broad the applicability is. Someone asked about how even a small country like Bhutan could learn from India's approach, suggesting the principles aren't just for massive nations seeking huge patient volumes. The integration of the wellness industry, that holistic aspect, was also reinforced again. The overall perspective seemed to be that India was just on this steep upward trajectory, potentially becoming, third globally in the market by 2020?
Third globally, wow.
With real momentum fueled by that public sector support, finally aligning with the established quality of care.
And for listeners who might have been interested back then or maybe attending similar events now, the webinar even shared a specific discount code for registration. GONDIA 2017, I think?
That's right. GONDIA 2017, which was valid until February 1st in the year that webinar took place, for a 20% discount.
Just an example of the practical takeaways.
It certainly encourages you, the listener, to consider how you or your organization might fit into this incredibly dynamic and rapidly growing global market.
Yeah.
It definitely raises an important question.
It really does. So just to quickly recap what we've pulled from this deep dive into the source material, we've seen India's strong foundation, that recent government focus really fueling massive growth,
Right.
how that powerful combination of high quality and low cost is attracting huge patient volumes.
The key driver.
The sheer scale of the economic opportunity, not just in treatments, but across the whole ecosystem.
The ancillary services, too.
How developing markets like India are actually reshaping the global medical tourism landscape, becoming buyers as well as providers.
That's a crucial shift.
And the specific avenues discussed in the source for making vital connections and boosting professional standing, like that conference and the certification.
So maybe here's a thought to leave you with, based on everything we've just explored from that webinar transcript. As developing markets, like India, transition from primarily being recipients of medical tourism to becoming these major players, buyers of expertise, investors, shapers of the global industry, what does this shift really mean for the future accessibility and delivery of advanced healthcare worldwide?
Interesting question.
And, how might this convergence we're seeing of medical treatment, wellness services, and international travel, how might that continue to evolve based on these innovative models, like the one clearly emerging in India? That's definitely something